Hi everyone, my name is Susan Davies and I welcome all of you to this webinar. It's put on by the Ohio Department of Health and this is the teacher training component of the Ohio Return to Learn concussion team model. I am an associate professor and coordinator of the school psychology program at the University of Dayton. And when I previously worked in the schools, there wasn't much dialogue about concussions. Teachers often didn't know when one of their students had sustained a concussion, or if they did, they weren't sure of how to accommodate symptoms. And in general, educators had very little awareness of how symptoms could affect students in schools. So a big part of this training emphasizes the fact that concussions aren't just for athletes. You may have many students in your classroom who sustain concussions in different ways through playground accidents, car accidents, falls, and so forth. So throughout this presentation, just keep in mind that every student is different. They may sustain their concussions in different ways, have different sets of symptoms, and we'll emphasize how you can provide appropriate adjustments and accommodations in the classroom as students return to school if they still have concussion symptoms. The first part of this training will include information on how concussions can affect your students' learning, health, and social emotional functioning. Next, we will go into information about return to learn, that return to academics in school, and why it's so important to student recovery. And then finally, we'll discuss some specific strategies for helping students recover from concussion, including classroom tips. So first we're going to talk a bit about what a concussion is, and it is actually a type of traumatic brain injury, which really sounds more serious than the word concussion, and so there are a lot of people who advocate for talking more about how a concussion is really a type of mild traumatic brain injury. And it's caused by a direct blow or jolt to the head, face, or neck, or by a blow to the body, like in a football game when a player is tackled and their head isn't directly hit, but that blow to the body can cause the head and brain to shift rapidly back and forth. And this shifting or shaking movement results in short-term impairment of neurological functioning. And this impairment isn't easily visible on typical hospital tests like MRIs or CAT scans. So at this point, the primary way concussions are diagnosed is by a constellation of symptoms. So we typically say that a concussion is a problem of function rather than structure. So it's not a structural injury like a bruise or bleed to the brain, but it's actually changes in neurochemistry in the brain. And what's happening in the brain cells at the moment of impact is that potassium ions are flowing out of the brain cells, calcium is flowing into the brain cells, and this leads the individual to feel off and to have signs and symptoms. The brain cells aren't able to properly deliver nutrients, particularly glucose, to the brain. And all of these changes make it difficult for a person to engage in many physical or mental activities. So in the next few slides, we're going to talk a little bit about what these neurometabolic changes mean for obvious signs that other people can see, but also symptoms that the individual feels and may report to a coach or to a friend or to a medical practitioner. So here are some obvious signs that people may see in an individual who has sustained a concussion. So these are things that we want our coaches and athletic trainers and athletes and teammates to be aware of, but we also want for parents and teachers and school nurses and playground aides to know concussion signs as well. And some of these may be very transient and short term, that appear just after the concussive blow, and then some of them may be more prolonged. So the individual may appear dazed or stunned, be confused about what had happened. They may answer questions more slowly than they typically would, or repeat questions. There may be a bit of transient amnesia where the individual has difficulty recalling events immediately before or after the hit, bump, or fall. The individual may or may not lose consciousness, although the vast majority of people who sustain concussions do not lose consciousness at all. That is definitely not a defining feature of a concussion. If they do lose consciousness, it will be only briefly. If there's a more prolonged loss of consciousness, that may be indicative of a more significant or severe brain injury. The individual also may show some behavioral or personality changes. They may be grumpier than usual. They may be a little bit more kind of dazed or defiant than usual. So we want to be on the lookout for overall behavior changes, relationship changes, and at school, the student may be more forgetful of class schedule or assignments. And sometimes people use the words signs and symptoms interchangeably, but they're really different things. So the signs that we talked about are things other people can observe. Symptoms are self-reported in the individual. And the CDC breaks concussion symptoms down into these four major categories. The first is cognitive symptoms. So the effects of a concussion on one's thinking. So somebody who's had a concussion may report feeling slowed down, have trouble concentrating, and have trouble remembering new information. And this difficulty with learning is such an important piece for educators to be aware of, that as the brain is going through that challenging process of healing and as their neurochemistry is trying to get back into balance, it is almost too much to ask that brain to learn all kinds of new information. The second category is physical symptoms, and one of the most common symptoms of a concussion is a headache. The individual may also have fuzzy or blurry vision. Typically, that resolves more quickly than the headache does. There may be nausea or vomiting early on. There frequently is sensitivity to noise or light. Someone who's had a concussion often feels best when they're in a quiet, dim, or dark room, especially in that first day or couple of days following the concussion. And then that can gradually change to maybe wearing sunglasses or earplugs to kind of muffle some of that intense stimuli. Physically, they may also just feel off kilter and have balance problems and overall feel exhausted, feeling tired, having little or no energy. The third category of symptoms are the emotional and mood symptoms, and these are caused both by the actual physiological changes that happen when there's been a concussion, but also after a mild traumatic brain injury. There may also be some situational variables that change that can lead to some of these emotional mood symptoms. So if you have a student athlete who was injured and then they're no longer able to play or practice, or if you have a young driver who had a car accident and sustained a concussion, that can also exacerbate their emotional and mood symptoms because maybe now they don't have their driving privileges and they're having some difficult situations with their parents. So often after a concussion, you'll see an individual who is more irritable than usual, have increased bouts of sadness, be overall more emotional, and have more nervousness and anxiety. And some of that also can tie in with the school piece, because if they're having cognitive symptoms and it's hard to learn new information, it's hard to concentrate in school, and they're feeling like school is more difficult than it used to be, and they're falling farther and farther behind on assignments, that can make that nervousness and anxiety all the more difficult. And then sleep symptoms is the first or the fourth category of the concussion symptoms, and it differs depending on the individual. They may sleep more than usual, they may sleep less than usual, or overall feel exhausted, but at the same time have trouble falling asleep. All of those symptoms can flare if the brain is asked to do more than it can tolerate. So if a student is required to take a long, extensive test or write a difficult essay, those cognitive tasks can make symptoms worse. The general treatment that's recommended at this time is physical and cognitive rest. Most students who have sustained concussions recover in 3 to 4 weeks. This time frame really can vary. Some students will show a strong recovery in just a couple of days and not have any more symptoms after that time. Other students may take months to recover, but the majority of students, about 80%, will recover and no longer show symptoms within 3 to 4 weeks. But during that recovery period, students should receive academic and environmental adjustments until their symptoms have resolved. So overall, what we want to do is, as a concussion team, help achieve a balance between physical and cognitive rest and helping students keep up with schoolwork. A school-based concussion team is a way of ensuring that every student who sustains a concussion is monitored for safe return to school and return to activity. And when any kind of health issue affects a student learning, such as cancer or any other kind of medical issue, we know that it's important for people within the school, the teachers, the nurses, the psychologists and counselors, to communicate with each other, but also communicate with medical personnel and with the student's family. It's important that the concussion team members are sensitive to the difficult situations that families may be encountering in the aftermath of a concussion, and that they're strong listeners, that they avoid being defensive if the family is upset about any way that the concussion is being managed, that they recognize fears and frustrations that the student and their family may be feeling, and that they focus on solution, collaboration, and working together toward common goals. There's more information about the school-based concussion team and who is on it and all of their different roles and responsibilities in the handbook that accompanies this training. But here I just want to emphasize your role on the team as a teacher. First and foremost, your responsibility is to help the student get the best education possible given the circumstances. So a student recovering from a concussion may not be able to engage in full academics, but there will be certain tasks that they are able to do. You will help them follow recommended academic adjustments during recovery, help the team monitor the student's progress, and help the team monitor the students' symptoms. Some students may have more intense symptoms at different times of the day or in different classes, and your input will be very valuable in helping the school-based concussion team determine if academic adjustments are still needed or if different strategies should be employed. As we've discussed, every concussion is different, every student is different. They're going to have different clusters of symptoms. Some students may have many cognitive symptoms but not really have difficulty with sleep. There may be some students who are very affected by physical symptoms but not so much in the other categories. And there may be students who have significant symptoms in all four of the symptom categories. Likewise, their recovery rates will vary. The overall return to activity plan that is advocated in this model is to first help the student return to learn, to get them back to full academics, to full school days, full curriculum expectations. And once they are back at school and they are asymptomatic, meaning they have no symptoms, then they can go through the return to play protocol that is advocated by the athletic departments. So students should not be going back to athletic play, to practice, or to games when they still have concussion symptoms at all. And we'll talk a little bit more about that later in the presentation. But they can start doing some academics, returning to school while they have symptoms, as long as the school community understands how to provide the appropriate environmental and academic adjustments while symptoms are present. In the immediate aftermath of a concussion, initially it's important for the student who's had a concussion to rest their brain and to get good sleep. Overall, the advice from physicians is to limit physical, emotional, or cognitive activities to a level that is tolerable to the student and that doesn't cause symptoms to flare or to re-emerge. But we know that it's not reasonable for a student to just be kept in a dark, quiet room for days on end, and it's not healthy. So we want students to engage in activity to a level that is tolerable. We look at exertion and rest as following along a continuum, and while we want them to progress toward full activity or no rest during the day to a level that is tolerable, to a level that doesn't cause their symptoms to reemerge or to flare. Here we have the stepwise return to academics progression, and there are more detailed descriptions of each of these steps in the manual that accompanies this presentation. So the first step is no school and total cognitive and physical rest. So in this phase of recovery, the student may have a high level of symptoms that prevent him or her from benefiting from being in school. And at this point, physical symptoms tend to be the most prominent and can interfere with even basic tasks. So the family should receive guidance from the healthcare professional regarding the student's readiness to return to school. And that decision would be based on the number, type, and severity of symptoms. And this first step for some students may only be a day, and they may soon be ready to move to step 2 of partial day attendance with adjustments. Some physicians may think that the student is recovering quickly enough that they could skip this partial day step entirely and move to a full day with adjustments. But the recommendation is to go to step 2. That would be a student who might attend school for a half day, or they may only attend for their core classes. Their symptoms have decreased to manageable levels, but at this point, symptoms may be exacerbated by certain mental activities that are complex, difficult, or have a long duration. So at this phase, we're really balancing rest with a gradual reintroduction to school, and the student's going to be encouraged to avoid tasks that produce, worsen, or increase symptoms. A good piece of advice is at this stage, there can be breaks folded into the school day, such as rest time in the nurse's office. At the third stage of the return to academic progression, the student would be back to school for a full day, but with adjustments. And those would be the adjustments that were identified on the academic adjustments form that are symptom-based. And at this phase, the student's overall symptoms have decreased both in number and severity. And they may, at this point, be exacerbated by certain activities, but there would be times when there would be cognitive activities or physical activities that are mild in nature that do not have a drastic effect on symptom levels. And by physical activities, we're still not talking at all about gym class or sports practice. Physical activities at this stage would be just walking throughout the school building, carrying a light load of books, and so forth. When the student can handle the full day with adjustments well and symptoms are resolving, they can move to step 4, which is the full day without adjustments. At this phase, the student may not have any symptoms or may have mild symptoms that are intermittent. At this point, adjustments are removed when the student can function fully without them. The student should still not be engaging in physical activity until released by a healthcare professional. And at that point, they can then move to step 5, which is a full day of school with full extracurricular involvement. It's advised that academic adjustments following concussion are front-loaded so that the student is provided ample adjustments to the classroom expectations and to the environment, and then those adjustments can be gradually withdrawn as the student recovers and as symptoms resolve. Some students might be reluctant to accept these adjustments and accommodations and instead try to push through their symptoms, and the motivation behind that may be that they just want to get through the work. They are stressed by the idea of homework piling up that make them very anxious. So really strong piece of advice to teachers is to determine how the workload can be modified so that anxiety is not as significant. We're going to talk a little bit about how adjustments can be mapped onto symptoms so that if students have general symptoms or cognitive, physical symptoms or emotional symptoms, how you can best choose appropriate adjustments. And then teachers can determine how to modify the workload. There may be some assignments that can completely be excused, and that can be one of the greatest gifts that a teacher can give to a student with a concussion because of that stress and anxiety that can be associated with assignments building up and building up. So there may be some assignments that don't have to be made up, or there may also be some assignments for which the student is accountable but does not need to complete the full assignment. So in this point, we would say they would be responsible for the content, but not for the process. So other classmates may need to write a 5-page paper on a book that was read, and perhaps the student who sustained a concussion can instead give a verbal summary to the teacher. Then there may also be assignments that we would call responsible assignments that must be completed by the student and will be graded. So if a teacher is having difficulty figuring out how to modify the workload and which assignments should be excused, accountable, or responsible assignments, that would be another role of the concussion team leader or a designated concussion team member like the school psychologist or the school counselor who can help teachers figure out how much work is tolerable. Here are descriptions of some of the items that can be selected on the academic adjustments for concussions checklist that is part of the support documents of this training. The first is the adjusted class schedule. The student could attend alternate days, for example, going to school every other day, have a shortened school day, have shortened class periods, or start the day late so that the student can sleep as late as possible. That can be a good choice, particularly in schools that start very early in the morning. Another one is having no PE class until being cleared by a healthcare professional, no physical play at recess, and in those cases, it's helpful to have a plan in place for what the student is going to do instead. So perhaps a good friend could be chosen to do a quiet activity with the student during recess or something along those lines to make sure that there isn't an undue opportunity for emotional or anxiety stressors because the student is missing out on social opportunities. The student may be permitted to audit a class or to participate in a class without producing work or getting graded if it's important for them to still be exposed to the content, but if it's also known that the production of work might exacerbate symptoms or if the grades they would receive for produced work wouldn't accurately reflect their true potential had there not been a concussion. Another general adjustment is avoidance of noisy and overstimulating environments such as band class, loud noisy hallways, pep assemblies, things like that. Allowing students to drop high-level or elective classes without a penalty if adjustments go on for a long period of time. And this would be a situation that might call for a sit-down team meeting with administrators, other team members, and parents. Removing or limiting testing and or high stakes projects during the recovery period. Again, those could be postponed, modified, or eliminated altogether depending on what the work is. And allowing alternate periods of mental exertion with periods of mental rest throughout the day. Some adjustments that would be appropriate for students who have significant cognitive symptoms include reducing class assignments and homework to only those tasks that are deemed absolutely critical, exempting non-essential written classwork or homework because the act of writing, especially on a computer, can be taxing and cause cognitive symptoms to flare. And also to base grades on adjusted homework. So the student doesn't also have the stressor of having their grades affected by their injury, by their medical condition. The teacher can provide extended time to complete assignments and tests, provide adjusted due dates. Once a key learning objective has been presenting, reducing repetition to maximize cognitive stamina. So if the rest of the class is, for example, doing 30 math problems, perhaps the student who still has concussion symptoms can only do 5 problems so they can demonstrate their knowledge with a fewer number of problems. Allowing the student to demonstrate understanding orally instead of in writing, again, to avoid the cognitive taxation of using a computer or writing an extensive essay. And providing written instruction for work that is deemed essential. And this is because it can be difficult for the student who has a concussion to process auditory information and to remember it. So when a lot of this is what you need to do instructions are given at the end of a class period, the rest of the class may process that just fine, but it can be really helpful to have that in writing for the student with a concussion, and maybe even providing a follow-up email to that student's parents, letting them know what that student might be working on at home. Providing class notes by the teacher or peer, again, for that same reason, because that auditory processing and retention of auditory information is challenging during concussion recovery. And then allowing the use of a computer, smartphone, or tape recorder to facilitate some of the information that is coming in during class, but also keeping in mind that the extensive use of a computer can cause concussion symptoms to flare. And then finally, allowing the use of notes for test taking because cognitive recall can be quite challenging during the concussion recovery period. If a student's symptom log indicates that they have significant physical symptoms, especially fatigue, these are some good strategies. First, allowing time to visit the school nurse or the school counselor, anyone who has a nice quiet office where they can rest. This is helpful if they have headaches or other physical symptoms. Allowing strategic rest breaks during the day. So that may be on an as needed basis, or they may be more structured. For example, 5 to 10 minutes every 30 to 45 minutes. In a middle school or high school setting, it's helpful to allow the student to pass in the hallway either before or after the crowds have cleared. Not only does that minimize their exposure to light and noise, but it also helps to protect them from a crowded, jostling situation. If a student has light sensitivity, it can be helpful to allow them to wear sunglasses or a brimmed hat indoors. Another way to control for light sensitivity is for teachers to draw blinds or to allow the student to sit away from the window. If the student has noise sensitivity, they can be permitted to study or work in a quiet space, a quiet room, away from visual and noise stimulation. And it's important that there be consideration and discussion around what's going to happen for that student during lunch and recess, and permitting them to spend that time in a quiet space for rest and control for noise sensitivity, but also considering if that is a time that they would be permitted to bring a friend along to eat with or to do a quiet activity with. And then finally, providing a quiet environment for taking tests. Here are some strategies for students who have emotional symptoms that have been identified by the symptom log. You might help develop a plan that allows the student to discreetly leave class as needed for rest breaks, and consider ways to keep the student engaged in extracurricular activities, particularly if they sustained a concussion in their favorite sport and they're no longer allowed to participate. Think about other ways that they can stay connected to their teammates or participate in other kinds of activities. So maybe they can still attend some sports activities but not fully participate in games or in practice. Providing a quiet place to allow for destimulation, helping them explore some alternative activities that are of a non-physical nature. Maybe they would be interested in getting involved in some clubs rather than sports. And then finally, developing an emotional support plan for the student, identifying somebody, particularly an adult at school, they can talk with if they are feeling overwhelmed. Thank you for your time and interest in this topic. More information is available in the handbook that accompanies this presentation. Pay particular attention to the appendices where there are symptom rating scales, checklists for accommodations in schools, and more.